Okay, today we will continue our lectures, which is about the alginate impression material. In the previous lecture, we talked about some properties of alginate. Now, today, we will talk about how to take impression with alginate. Okay, before taking impression for each patient, you must explain the procedure, the type of the material, the time of the procedure before taking impression for the patient. By the way, the patient must know about the some properties, some experience about the procedure. First of all, tell the patient that, what's the material. First of all, tell the patient the material will feel cold. There is no any unpleasant taste, and the material set quickly in a minute. Number two, ask the patient breathe deeply through your nose to help relax and more comfortable during taking impression. Tell the patient if you have any problem, just send me your signal by your hand in order to know about the impression. Okay. The manipulation, after that, we will start for the manipulations of the procedure. Okay. By the way, the alginate is available in three types, either in a jar or can, or in pre-weighed patient, or in a nylon package. Okay, for each one, you can fluff the powder by inverting the can several times. What's the benefit of it? To ensure uniform distribution of the filler before mixing. You must shake the علبة. You must shake the package in order to distribute all of the particle of the alginate. After that, the water and the powder ratio specified by the manufacturer, not according your. The manufacturer write down for you for each measurement scoop of water at. After that, place the water in a rubber bowl. After that, put the powder into the water. Little by little, add powder to the water in order to ensure all of the particles of the powder wet evenly. If vice versa, put the water, put the powder before inserting the water. What will happen? The chemical change of some particle will start before some other. That's why it is impossible to put the powder before the water in the rubber bowl. After that, after putting the water with the powder, now we will mix. How to mix? By stirring motion. يعني داير ما داير الجدار مال الباول الربل باول must be mixed with the spatula. Okay. Rapid spatulation by sweeping against the side of the bowl is done. How you mix intra-rubber bowl? By figure of 8 motion. Figure of 8 رقم 8 هيجي intraorally هيجي mixing like this. This is the can. Before starting, you must be shaken in order to distribute all of the particle. After that, put the scoop of powder before it. Insert the water. After that, insert the powder. After that, mix by the aid of the spatula by figure of 8. Till here it is clear. Like this. Figure of 8. داير ما داير. Mixing like this. For both of them, it is a pink color. But this pink with water, this pink without water must be like this. Okay? Must be like this. Okay. We have, you must mix the alginate in a manner, must be in good way. Why? It gives us a smooth, shiny, bristle surface of the alginate. We have sometimes mechanical mixing by the aid of mixer. What is the benefit of it? It is speed, convenience, it is simple to use, and avoid human variable. What do you mean by human variable? Sometimes we can add powder or increase the rate of water or increase or decrease the time of mixing. All of this is a human variable. After that, after mixing is done, you must tray selections of the tray. By the way, for alginate we need a perforations lock tray. How? Either by a rim lock or perforation you must do by yourself, or sometimes you can do increase the rate of retentions of the material by the aid of adhesive material. Put the adhesive material to the entire surface of the tray. After that, put the impression into the tray in order to thickness of the material with the tray. Or sometimes we will use combinations above ways. And the borders of the tray must be available at least 3 mm in order to record all around the borders. After that, loading the tray. Okay, insert the alginate into the tray, and the surface of the alginate must be smoothed by the aid of your finger with the water. And before insertion the tray into the mouth of the patient, a small amount of the impression must be placed by your index finger to the dentate area. What is the benefit of it? In order to decrease the amount of bubbles and voids and increase the accuracy, a final detail. After that, insert the tray into the mouth of the patient, and we will wait till setting without any jerk movement. How you know this is the final setting? Uh, by insert the blunt instrument into the tray. If it is difficult to penetrate it means it's good time for removal. Okay. And sometimes you have color code matching. During setting, the color of the alginate will change to another color. Removal of the impression. The alginate, after setting, develop a very effective peripheral seal. How you remove this peripheral seal? By running your finger all around the borders of the tray. The impression must be removed indirectly in sudden movement downward. Okay? If it is gentle, continuous movements of the tray, it can cause tearing or separate away from the tray. That's why you must apply a jerk movement, sudden movement downward. After removal of the impression from the mouth, the impression should be washed with cold water to remove the saliva. Number one. Number two, disinfect it by immersing in glutaraldehyde. After that, cover it with a damp napkin. Why? In order to prevent drying of the impression. After that, the cast should be as soon as possible, at least 15 minutes after taking impression. Storage of alginate impression. As we said, the impression must be put as soon as possible. If you don't have time to put it immediately, what we can do, first of all, you can apply a paper towel to cover the rubber ball or keep the impression into the plastic bag under both of conditions. The impression must be put not more than 1 hour. Why? Because it can cause dimensional change of the impression material. After pouring of the alginate, the cast must be removed from the impression at least 45 minutes, not more than. Why? First of all, it acts as a sponge. Why? Because the alginate it will bring the water from the stone. The cast, what will happen? The cast can cause a choky like a cheese. And dried alginate becomes stiff. Sometimes can cause fractures of the dentate area, teeth. By the way, what is the uses of alginate? What's the uses of alginate? First of all, for making primary impression. Primary impression like what? Edentulous patient, for complete denture, in the patient with excessive flow of saliva, or for partial dentate with clasps. All of the three, it means it's primary impression. Sometimes you can use for study model for diagnosis. Sometimes you can use it for orthodontic study model for treatment plan. Sometimes you can take impression for preparation of the mouth protector for athletes الرياضيين. The advantage of alginate: number one, ease of mixing and manipulation. It is simple during mixing and manipulation. Number two, not need any expensive equipment. ما يريد الأجهزة غالية. Number three, material is elastic. It removed from the mouth easily and simple. Number four, economically. It is not expensive. The pleasant taste and odor, and that's why it's comfortable for the patient. Disadvantage: it cannot be electroplated. What do you mean by electroplated? Electroplate, that means adhesion between two material. For example, when you make a bridge, the internal surface it's metal, the external surface it is ceramic. How you join two material with each other? By the procedure we call electroplate. This is number one. Number two, the tearing. This is the one of the disadvantage in thin section. Dimensionally not stable. Distortion sometimes can be occur and cannot be refined during taking impression. So you have some failures of alginate. Some failure. Number one, defect. How you know this is the defect? You have some points. Tell us this is the defect. Number one, improper mixing. Too much mixing. Too much gelation. Water powder ratio is too low. All of these points can cause defect during taking impression. Tearing. This is the second defect. How it will occur: inadequate bulk, moisture contamination, and premature remove from the mouth. And prolonged mixing can cause tearing. External bubbles. Sometimes you have bubbles. فقاعات. Undulation. Air incorporation during mixing when you use without vibrator. Irregularly shaped void, moisture or debris. Chalk stone model. Number one, inadequate cleaning of the impression, excessive water left in the impression, premature removal of model from the impression. Distortion, impression not poured immediately, number one. Number two, movement of the tray during setting. Removal from the mouth too early. Improper removal from the mouth. All of them, it can cause distortion. And thank you.